Hi, my name is Amy Harris and I work for Marylebone Health Group, and today I'm going to talk about shoulder instability. Now, shoulder instability is usually laxity within the shoulder joint, so it can be the ligaments, the tendons around the capsule around the joint, and this can happen in many different ways. So generally, if you've had a shoulder dislocation, you'll get a little bit of instability. So for example, if you've had some kind of trauma, so if you've fallen onto an outstretched hand and you've had an anterior translation of the shoulder joint forwards, this can cause some laxity, and also it can damage some of the labrum within the shoulder, which also creates stability. Now, when it comes to treating shoulder instability, there are several different options. So depending on your age or what's happened to you, you might go and see a consultant and they will discuss with you different options. So they might do the relevant imaging just to make sure that they'll check the integrity of the joint, so whether they look at the bone and then the soft tissue structures. And then from there, they make a decision on whether they want to operate or not, especially if you're somebody who likes to participate in sport. Now, in most cases, lots of individuals and consultants do like to go down the conservative management to start with. And this usually involves seeing a physiotherapist like myself. So what do we do, what to expect when you go and see a physio? Now, usually we go through a discussion and to see what's actually happened. We'll also discuss what you like to do. So it could be that you do participate in sport and we need to try and get the shoulder back to good function and then get you back to playing your relevant sport. So when it comes to actually restoring function of the shoulder, you'll go through a physical assessment. And you'll go through some diagnostics, so we'll have a look at the strength and the capacity of the muscles and structures around the shoulder. And this is where we can really hone in and prioritise what actually we need to go after, so the deficits, so where some areas might be weaker than others, and we can focus on that and prioritise as we go along. And then once we restore the strength and what we need to, then we decide to look at, right, what specifically do we need to do to get you back to where you want to go in terms of your goals. Now, in the meantime, we also make sure that we're in contact with your consultant just so that you're on the right track, and it doesn't stop there. So even if we've done everything that we need to do, you've always got the choice to see if you do want to go down the surgical route, but generally physiotherapy does really, really well, and lots of patients don't need to go down the surgical route. So physiotherapy can make a really big difference when it comes to restoring shoulder function.